How you doing, guys? This is Kento at Kamiyama Physical Therapy. In today's video, we're going to talk about what shoes are right for me. More specifically, we're not going to talk about one sneaker is the magic sneaker. So we're not going to say like the Nike Pegasus is the right thing or Reebok. We're really going to talk about what are some factors that leads to the shoe that is individually right for you. So by and large, we have three factors, or I think there's three factors that we need to consider before giving you the sneaker that is good for you. Number one, first thing is the individual's health and fitness. What I mean by that is, do you have back pain? Is the person having bunions? Do you have the Achilles pain that we're kind of right here? Depending on what you may have, you may need a little bit of more heel, or you may need a little more cushion, or you may need an orthotic. All those will come into factor on what type of sneaker do you want. For example, a person that has Achilles pain may not want something like a shoe that's really, really flat, where you put a lot of stress on your heel that might aggravate their Achilles tendon. So they may need something that has a little bit of a heel raise or heel cushion to help with their current pain symptoms. All right? Number two are the goals of the individual. What is the individual wanting to do, or where do they want to go? So let's say, for the previous example, the individual wants to have pain relief in their Achilles tendon. Then for the first month or so, or whatever the time frame may be, having a nice heel cushion might be a good way to bring their heel pain down. However, know that when you have heel cushion to decrease the heel pain, might only be a temporary relief or a band-aid to the shoe. It may go away permanently, but more often than not, it's a band-aid to the individual. So what they need slowly is corrective exercises, different rehab, and slowly but surely decreasing their heel support to allow the heel or the body to work harder in order for them to progress further. So this is a very important point where number one tells you where the individual is currently at, and number two is where the individual needs to go to. And depending on that, the type of shoe you may recommend may differ. Number three is what type of shoe that we just kind of talked about. So how you may look at this is the process goes from 1 to 3. So if the individual, where you know where the person's at, you can give them something currently to help them where they need, to help them kind of work on their acute pain, or just their pain that they currently have. Number two, if you know where the goal of the individual is, you kind of have an idea of what kind of shoe you want to give them eventually, so they can keep progressing and keep improving. So by doing so, you kind of have a better idea of what type of shoe they need. They may need a heel pad or a heel cushion currently for their person's individual status, but eventually need something that needs to have the foot work harder, so the foot gets stronger, the overall person's whole body gets better and more progressed. Hope this makes sense. If you have any questions further than that, feel free to contact us in the comments below.